and welcome. Thank you for joining me. My name is Janelle Marzai, and I'm the Healthcare Facilitator here at UCSB. In this presentation, I will provide a high-level comparison of the UC medical plan options for 2026 and a quick overview of our non-medical plans. This presentation is intended for communication purposes only. Please visit UCNet website and plan documents for complete information. Another great resource is the Open Enrollment brochure, which was mailed to you, or you can find it on the Open Enrollment website and UCNet. Most of the content I will cover in this presentation can be found on UCNet and also in the plan booklet, which medical plan is right for you. Some health plans are changing for 2026. First is the transition to Blue Shield of California from Anthem Blue Cross for faculty, staff, and non-Medicare retiree PPO plans. After a competitive bid process in 2024, Blue Shield was selected to replace Anthem as a third-party administrator for the PPO plans, UC Care and the Health Savings Plus plan. Second, UC is offering a new high-deductible health plan compatible with the Health Savings Plus. The new plan called Health Savings Plus will replace both the UC Health Savings Plan and the Core Plan. Members of those plans will default into the new Health Savings Plus plan unless you enroll in another plan during open enrollment. The Health Savings Plus plan is designed to offer advantages of the HSA, including a larger contribution from UC with a more affordable contribution than the current Health Savings Plus plan. The default plan for open enrollment is the new Health Savings Plus plan. In previous years, it was the core plan, and now starting in 2026, the Health Savings Plus plan will be the default plan. Additionally, starting for 2026 for split families, UC Medicare PPO and UC Care will be the only option for split families. Per IRS rule, you can't be enrolled in Medicare plan with an HSA plan. Topics. We will discuss plan comparison and enhancements, rates, priorities, residence limitations, choice of physician, quick medical plan descriptions, cost of care and prescription drugs, out-of-pocket maximum, health savings account HSA, behavioral health, chiropractic and acupuncture, living out of the country, non-medical plan updates, and resources. Next, we will review the PPO plan comparison changes. As you see in 2026, Blue Shield will be the administrator for the Health Savings Plus and UC Care PPO plans. Accolade will continue to be member services and healthcare advocacy, and Navitus will continue to be the pharmacy benefit manager. So as you know, Core and the Health Savings Plan will not be available starting in 2026. So if you're currently enrolled in those plans, this chart shows you the comparison of the current plan and plan replacement. For the new Health Savings Plus plan, the deductible for a network is $2,500 and $5,000 for family. For out-of-network, out-of-pocket max, it's $6,700 single and $13,400 for family for the Health Savings Plus plan. For preventative care, $0 copay. For office visits, specialist visits, labs, imaging, mental health, maternity care, and hospitalization, 30% coinsurance after the deductible has been met. For urgent care, emergency room visits, ambulance transports, and retail clinic visits, 30% coinsurance after the deductible has been met. For prescription drugs and network participating pharmacies, you'll pay the full cost of pharmacy until deductible is reached, then 30% coinsurance for covered drugs. For the UC Care and Health Savings Plus plan, pharmacy changes starting in 2026. The copay card savings will no longer occur to the out-of-pocket maximum. This program provides discounts to the cost of expensive drugs. New criteria for all weight loss medication coverage for weight loss management. You must have a BMI of 40 or higher regardless of comorbidity conditions. Members currently on these drugs known as GLP-1s who started with at least 40 BMI could continue with recertification. This slide illustrates the UC Care and Health Savings Plus travel expense benefits for surgeries. For 2026, there will be an increase for lodging up to $250 a night per person, 1 caregiver per adult patient, up to 2 caregivers for a minor, and for food, $150 a day per person. And this is all for transplant, bariatric surgery, gender affirmation care, gene therapy for ocular disorder. For travel vaccines, here's the cost for travel vaccines for our PPO plans. For UC Care Tier 1 and Tier 2, it's at zero cost. For Tier 3, 50% coinsurance. For the Health Savings Plus plan, in-network is 30% coinsurance, out-of-network is 50%. For the Medicare PPO and high option plan, after the deductible is met, in-network is 20% of the allowed amount, and out-of-network is also 20% of the billed amount. Okay, the following next two slides, we will discuss legislative mandates for the Blue and Gold and the Kaiser plan. Benefits for infertility services and prescriptions will be expanded and made more affordable for Kaiser HMO and the UC Blue and Gold members. Trying to grow their families, coverage will expand to include up to 3 complete cycles, egg retrievals per lifetime, unlimited embryo transfers for IVF, GIFT, and ZIFT per member. Infertility services and prescriptions will be covered at the plan-specific cost share. For the Blue and Gold HMO and Kaiser HMO plans, for human milk, it adds medically necessary pasteurized human donor milk obtained from a licensed tissue bank as a basic health care service, ensuring access which was previously limited by insurance coverage barriers, and it simplifies the process for hospitals to distribute donor milk by removing certain regulatory hurdles. And next is the Children and Youth Behavioral Health Initiative, requires health plans to provide coverage for mental health and substance use disorder treatment services provided at school site when the services are provided or arranged by a local educational agency or public institution of higher education. Moving on to plan changes for the UC Blue and Gold plan for musculoskeletal care management and interventional pain management programs starting in 2026. Evolvent will manage prior authorizations for both musculoskeletal care management and interventional pain management programs, and also ShareCare virtual cooking class, up to 5 virtual cooking classes to UC locations at no cost. Weight loss medication criteria change. Okay, so here are the weight loss medication criteria for 2026. For GLP-1s, the BMI of 40 plus will be available for members with a body mass index of a BMI of 40 or higher. These medications will continue to be covered at current eligibility criteria for members with type 2 diabetes. For the UC Blue and Gold plan, you must have a BMI of 40 or more for new prescriptions, no exceptions for comorbidities. For Kaiser HMO, you can have a BMI of 40 plus for weight loss only, a BMI of 30 plus for moderate severe obstructive sleep apnea, for BMI 27 plus with one of these comorbidities, peripheral artery disease, history of stroke or heart attack. For both UC Care and the Health Saving Plus plan, you must have a BMI of 40 plus for new prescriptions, no exceptions for comorbidities. Okay, 2026 employee contributions. To help UC make decisions based on current data, UC brought in Mercer, a national benefits consulting firm, to analyze UC's medical plan benefits, review trends in premium and employee contributions, and assess the methodology UC has used to determine how much of the medical premiums it pays on behalf of employees. First, UC's new strategy is to balance premium evenly across health plans with similar level of coverage and to invest equally in all UC's plans. UC will cover the same dollar amount for all non-Kaiser plans and the same percentage of the total cost for Kaiser HMO and UC Blue and Gold HMO. The UC Health Savings Plan members have seen unprecedented increases in their premiums over the last few years, while core members have missed out on the tax advantages of the health savings account. Many members, especially those who are enrolled in the UC Care or who are moving from the Health Savings Plan to Health Savings Plus, will see a lower monthly premium. Some members from the Core to Health Savings Plus will see premiums that are up to $20 a month higher for single coverage and up to around $94 for family coverage. These premiums increase will be offset by UC's contribution to the health savings account. Some Kaiser HMO members who pay for single coverage may see increases up to $36 a month. Some Kaiser HMO members who pay for family coverage may see increases up to $169 a month. UC Care members will see a decrease in their premiums for 2026. All right, getting started. Each of the UC medical plans offers similar coverage. Additionally, all plans cover preventive care at no cost when you see in-network providers. One of the first ways of finding a plan that best meets your needs is understanding your priorities. Is your priority the cost to be enrolled in a plan, choice of providers, or effort to manage the plan? There are resident limitations depending on what plan you elect. So here are some things to keep in mind. For the UC Blue and Gold plan and Kaiser HMO plans, the employee must live in California and your primary physician or medical group must be within 30 miles of where you live and work. I also want to emphasize that UCLA Health in Santa Barbara is not in network with Blue and Gold plan. There are a few reasons. First, the state sets the criteria of which medical groups accept HMO plans. There needs to be a certain amount of specialties at that location within 30 miles. There are currently not enough specialties at UCLA Health in Santa Barbara. Right now, UCLA Health primarily provides primary care services. So when you have an HMO plan, your PCP constantly needs to refer you out to specialists. And with UCLA Health, there's not enough specialists. They would be referring you out to, LA, Thousand Oaks, and Ventura County, which is outside of the 30-mile radius. For the Health Savings Plus plan and the UC Care PPO plan, the employee may live anywhere but must have a U.S. address, and it does offer worldwide coverage. So for the Health Savings Plus plan, you can live anywhere, but you must have a U.S. mail address to contribute to the HSA account. So you can still live anywhere. You can still be in the Health Savings Plus plan, but if you do not have a U.S. address, you cannot contribute to the HSA, and the university will not be able to contribute as well. And that's due to the financial institutions are legally required by the U.S. Patriot Act to verify the identity of anyone operating an account. And this verification process includes physical U.S. addresses, not post office box. And even with the enrollment in the Health Savings Plus plan, the individual will not be able to contribute, but they can still maintain to be enrolled in the plan. And that just meets the criteria for the U.S. Patriot Act. Your choice of physician will vary depending on which plan you elect. Under the HMO plans, you assign yourself to a primary care physician medical group. Your PCP coordinates your care and refers you to a specialist who are contracted with the medical group. Out-of-network coverage is not available under the HMO plans. Under the UC Care PPO plan, Blue Shield is your preferred provider. Under this plan, you have access to UC Select and Blue Shield preferred providers, as well as out-of-network providers. Under the Health Savings Plus plan, Blue Shield is also your preferred in-network provider, and you have access to out-of-network providers. Let's take a moment to look into the 3 tiers more closely for UC Care PPO. UC Select Tier 1 and Blue Shield Preferred Tier 2 are going to be your in-network providers. Your UC Select Tier 1 providers are UC Medical Centers and Select Blue Shield Preferred providers who are contracted under the UC Select Tier 1. For Blue Shield Preferred Tier 2, that's going to be your Blue Shield Preferred providers. If you're outside of California, it will be your Blue Cross Blue Shield providers. If you're outside of the US, it will be Global Core. Then, of course, you have Tier 3, and any provider that is not in network will be out of network. Okay, UC Select in Santa Barbara is limited to Sutter Health, Cottage Hospital System, Quest Diagnostics, Pacific Diagnostics Lab, Pueblo Radiology, UCLA Health. And please search the Blue Shield directory for other local UC Select providers, and that includes Tier 1 and Tier 2. As I mentioned in the previous slides, there are additional UC Select Tier 1 providers locally in the Santa Barbara and Ventura counties. You can search for those providers via the Blue Shield directory online or by contacting Accolade. Let's take a closer look at our medical plans. Terminology. UC HMOs do not have deductibles. A copay is a fixed rate for each service. UC PPOs have deductibles and coinsurance. Deductible is the amount you pay each year before the plan starts sharing the cost with you. Coinsurance is the share of the cost after you pay the deductible. Your costs are based on the network the provider is in and the service you receive. You pay discounted rates for in-network providers, and you pay for more for out-of-network providers. Under the PPO plans, the plan negotiates allowed rates to process claims. The discounted rate is the amount each plan negotiates with preferred or participating providers. You pay the in-network coinsurance on the discounted rate, and the provider cannot balance bill. So just here is an example for UC Care and the Health Savings Plus plan. When using out-of-network providers, Blue Shield assigns allowed rates to process claims. When a provider is out-of-network, they are not subject to the discounted in-network rate. Blue Shield will pay that out-of-network coinsurance on the assigned amount, and the provider can balance bill you the difference. Out-of-pocket maximum. Each of the UC medical plans have an out-of-pocket maximum, which helps limit your financial liability per year. This means that if you or someone in your family experience a catastrophic event, you are not slammed with a $100,000 bill at the end of the year. The out-of-pocket maximum is the maximum amount a plan requires an individual or family to pay in a calendar year before the plan pays 100%. The out-of-pocket maximum includes copays, deductibles, coinsurance for medical services, behavioral health, and prescription medication. The table on the right shows the individual and family out-of-pocket maximum each of the plans for 2026. The Health Savings Plus plan is a high deductible plan paired with the Health Savings account. This is the only UC medical plan that meets the IRS requirements for the Health Savings account. That said, the Health Savings Plus plan is a two-part plan that the medical component is administered by Blue Shield and the Health Savings account component is administered by Health Equity. There are many advantages to having a health savings account. With the health savings account, you keep the money even if you change jobs or insurance plans. You can make contribution at any time. You can increase or decrease your contributions throughout the year. HSA has triple tax advantages: no federal taxes on contributions, no taxes when funds are used, no taxes on earnings. HSA funds roll over from year to year. You can invest funds to earn more. Before enrolling in the Health Savings Plus plan, there are some things you need to consider in order to own and contribute to the Health Savings account. First, you cannot be enrolled in Medicare Part A or Part B. Second, you cannot be enrolled in any other medical plan. And finally, you cannot be claimed as a dependent on someone else's tax return. If you're enrolled in the Health Savings Plus plan as of January 1st, 2026, the UC contribution of $750 for family HSA or $1,500 for family. You can then contribute anytime up to the IRS limit. The 2026 IRS max for individual is $4,400 and $8,750 for the family. Keep in mind that you must account for the UC contribution when calculating your HSA contributions to ensure you do not exceed the IRS limit. Okay, comparing our medical plan copays and coinsurance. Okay, let's take a closer look at office visits. For our HMO plans, UC, Blue and Gold, and Kaiser, these plans do not have a deductible or coinsurance. Instead, you pay $30 for each visit. As you can see, the cost breakdown remains the same for hospital and outpatient surgery for our HMO plans. Under the UC, Blue and Gold, and Kaiser plans, you pay a copay or hospital visit for outpatient surgery. And then under the UC Select Tier 1 of UC Care PPO plan, you will also pay a copay for these services, whereas you must meet the deductible first under Blue Shield Preferred Tier 2 and out-of-network Tier 3 before Blue Shield starts sharing the cost with you. For emergency room visits, you will pay a $125 copay for emergency room visit under the HMO plans. For UC Blue and Gold, then $125 if your copay is waived. So for the UC Care PPO, UC Select Tier 1, it's $300, and it is also waived if you are admitted to the hospital. For the emergency room visit, cost breakdown remains the same for the Health Savings Plus plan, and that you must first meet your deductible first before Blue Shield start sharing the cost with you. So you will pay 30% coinsurance, and if there is a physician fee, it is also 30% coinsurance. Okay, moving on to behavioral health. For each of our medical plans, it offers behavioral health coverage, and the medical plan you elect will determine your behavioral health provider. Furthermore, a referral is not required when accessing a behavioral health provider. The in-network behavioral health provider for UC Blue and Gold HMO plan is the HealthNet Behavioral Health. For Kaiser, you have two options between Optum Behavioral Health or Kaiser Behavioral Health. And then Blue Shield is the in-network provider for our PPO plan, for both of our PPO plans, which includes UC Care and the Health Savings Plus plan. Under the HMO plans and Tier 1, Tier 2 of the UC Care PPO, the cost for the first 3 visits is $0 copay, and then you will pay $30 per visit at the 4th visit for in-network providers. Under the Health Savings Plus plan, once your deductible has been met, Blue Shield pays 70% and you pay 30% coinsurance for in-network providers. You also have specific providers for chiropractic and acupuncture care. American Specialty Health is the chiropractic and acupuncture provider for UC Blue and Gold and Kaiser. This service is self-referred and you are limited to 24 combined visits in a year. Under the UC Care PPO and Blue Shield is your in-network provider. Chiropractic and acupuncture care is not available at UC Select Tier 1 level. However, it is available at Blue Shield Preferred Tier 2 and out-of-network Tier 3. Like the HMO plans, you are limited to 24 combined visits in a calendar year. Under the Health Savings Plus plan, Blue Shield is your in-network provider, and you pay 30% coinsurance after you've met your deductible. When traveling outside the U.S., each of the UC medical plans provide a certain level of coverage when traveling outside of the U.S. For our HMO plans, HealthNet and Kaiser, you are limited to emergency care and urgent care when traveling outside of the U.S., whereas the UC Care and Health Savings Plus plan offers worldwide coverage. Under the UC Care PPO plan, Blue Shield will cover outside the U.S. at Tier 2 and Tier 3 levels, and Blue Shield can pay at the in-network and out-of-network level for the Health Savings Plus plan. Okay, let's review our non-medical plan changes. Starting with Delta Dental, UC is continuing the relationship with Delta Dental for both the PPO and HMO plans. Earlier this year, UC conducted a comprehensive dental RFP to evaluate our plans and provider networks. A key finding was that provider terminations are not unique to Delta Dental, but rather a trend across the entire dental industry. Our goal is to support members through these changes and to help minimize disruption to care. So to ease the impact of these changes, starting January 1st, 2026, UC is introducing enhanced coverage for our PPO plan members receiving care from premier and out-of-network providers. What will happen is that maximum contract allowance limits for ciliants, root canals, gum disease, and oral surgery will increase from 75% to 80%. These enhancements are designed to provide financial relief to individuals seeking treatment from non-PPO providers. As a reminder, PPO providers still offer the highest value, so members are encouraged to use in-network dentists whenever possible. As for the Delta Care USA plan, its plan design will remain unchanged for 2026. And moving on to vision, we are continuing our partnership with VSP. No plan design changes for 2026. Okay, moving on to our UC supplemental plans. Prudential will continue to administer the supplemental plans and premiums will remain at 2025 levels for all 3 plans. There are no plan design changes for accident or critical illness. However, starting in 2026, the hospital identities plan's hospital admission observation requirement will be reduced from 24 to 18 hours. These changes recognizes the advancements in medical practices that have allowed hospitals to reduce admission durations and achieve quicker recovery times, which benefits enrollees. Just to reiterate, participants will only need to meet the 18-hour requirement to receive the hospital admission benefit, making it easier for them to receive financial protection for hospital stays that require significant care. All 3 plans are open for open enrollment. Moving on to legal, no benefit coverage or premium changes for 2026. We are maintaining our partnership with ARG. Plan is open for open enrollment. For disability, Lincoln Financial continues as our partner, and there will be no benefit or rate changes to any of the plans. Disability plans are not open for open enrollment during OE, but employees may enroll at any time by completing the evidence insurability application and submit it to Lincoln Financial for review and approval. And Bright Horizons continues to provide family care and referral services. UC continues to pay the cost for eligible employees to participate. The system-wide program with Bright Horizons provides referral services only, and UC does not contribute toward employees' family care costs. UC is maintaining our relationship with Experian, our identity theft protection plan administrator. Otherwise, there are no changes to the monitoring service, and UC continues to pay the full premium for faculty, staff, and retirees' dependent children up to 18. For adoption, WEX Health continues as the claims administrator for adoption plan. The reimbursement limit remains at $5,000 for qualified expenses. And finally, pet insurance coverage continues to be offered at individual policies purchased directly from Nationwide, and this plan is open for open enrollment. Okay, flexible spending account. The 2026 FSA contribution limited increased to $3,300, and the carryover limit from 2025 to 2026 is $660. Dependent care FSA limit has also increased to $7,500 for non-highly compensated employees and $3,300 for highly compensated employees. Please take a moment to look at the 2025 Health FSA runout period and filing deadline, which will be April 15th, 2026 for Health FSA, and the carryover, which will mean the funds will be available starting January 1st, 2026. For Dependent Care FSA, the runout period filing deadline is April 15th, 2026, and there will be a grace period between January 1st, 2026 and March 15th, 2026. Okay, the Limited Purpose FSA. If you participated in the Health FSA and have a carryover balance of $25 or more at the end of the year, and you enroll in a Health Savings Plus for the following plan year, a limited purpose flexible spending account will be created for you automatically, and the balance of your Health FSA that is eligible for carryover will be placed in the limited purpose flexible spending account. Available only to employees meeting all the following criteria: are eligible for faculty staff benefits, participated in the Health FSA during a plan year, have a carryover balance greater than $25 at the end of that plan year, and enroll in a Health Savings Plus plan for the following year. So core participants who default to Health Savings Plus plan for 2026 due to no active enrollment changes during open enrollment will be automatically enrolled in the 2026 Limited Purpose FSA if they meet all the above criteria. Balance of Health FSA up to $660 is placed in the Limited Purpose FSA. Participants may not contribute additional funds. Eligible expenses are restricted to dental, vision, and preventative care services. Participation limited to 1 year. Any balance remaining at the end of the run-up period is forfeited. Fidelity. Andrew Fung is our location financial consultant. He can help you with understanding your retirement saving program, evaluating your individual situation and priorities, rollovers into UC retirement saving program, comprehensive retirement income planning, legacy planning, charitable giving, and tax strategies. I'd like to take a moment to briefly highlight on all the open enrollment resources available to you. UCNet and the Open Enrollment website is where you can access the 2026 plan documents and changes. UCPath is where you'll need to go to submit your open enrollment changes. If you have general open enrollment or benefit questions, you can submit tickets through UCSB HR ServiceNow portal. And finally, if you have access to view our other videos, please check out the Healthcare Facilitator YouTube channel. This recording is this video presentation will be posted on the Healthcare Facilitator YouTube channel. And that concludes this presentation. Thank you so much for joining us today.